What is the government shutdown all about? Well, thousands of Nebraska families could see their health insurance costs double by January, and right now there's nothing they can do to stop it. Local 4's Ian Mason explains why your health care costs could be the next casualty of the government shutdown.
While most people get health care through their workplace, not all jobs offer it, especially low-paying ones or small businesses. Sonia Weinrich has used the Affordable Care Act coverage for over 10 years, and it was the only way she and her husband could afford to get care.
And it has always been very, very beneficial for us.
This means if you want affordable insurance, you're going to go through the Affordable Care Act marketplace, where the government may foot some of the cost with you.
Government does provide subsidies for people that are buying Affordable Care Act, Obamacare on the exchanges. So this is for people that are low to moderate income. And what it is they pay a portion and then the government pays a portion as well.
The main feature of the Affordable Care Act is that these plans must cover anyone and cannot deny coverage, meaning that there is more of a cost to provide insurance to potentially higher risk patients. But some question whether the taxpayers can afford the rising costs.
The Affordable Care Act protects all Americans, healthy or sick. A cancer patient has extensive amount of claims to the carrier and the plan. That plan has to account for how to pay for that plan.
Rising healthcare costs mean that the cost of plans is increasing, hence the need for government subsidies. But those tax credits expire on December 31st, meaning that for some, the cost of their insurance could increase significantly.
If the subsidies are not continued, people are going to see a very large increase in their premiums for healthcare.
A lot of people are going to see, probably about a doubling of what they were paying for health insurance in this marketplace exchange. In Nebraska, we have about 140,000 individuals who get their coverage on the ACA marketplace.
And let's remember who's buying on the exchanges. Again, it's low and moderate income people, it's self-employed people, it's small business owners, it's farmers, it's ranchers.
The Kaiser Family Foundation, a nonpartisan health policy research group, estimates a family of four making around $90,000 a year, which is about the average in the state of Nebraska, would see the price of their health care increase around $3,700 a year, a plan that would now cost over 9% of their income.
We won't be able to afford to pay for, $1,600, $2,000 a month, however that plays out, which means we would not have insurance to cover that. It makes me nervous. What's going to happen to us medically?
Over the weekend, Weinrich learned that her premiums rose by over $300 a month, meaning that they can keep their coverage, but she questions how long that will last. With the federal deficit growing, many argue that the government can't afford to continue to subsidize plans for people who make 400% over the federal poverty level.
In my own personal opinion, think that we should stair-step this down and look at cuts that are appropriate to the American people and the impact to the American people, equally taking care of the fiduciary responsibility of managing our money and our taxpayer dollars. The fact continues to illustrate that the amount of subsidies to health plans are unaffordable to our national budget.
The Democrats in the Senate say they want these credits, which were not renewed over the summer, to be placed in the next spending package, and say they won't vote for anything that doesn't include it.
We really need to do something about these premiums. We know it. We understand it. These premiums are a problem because, especially in rural states, they're hitting in a big way.
The Republicans in the Senate say they want to pass a continuing resolution, which means the government will continue to operate as it already is. And after reopening, then they'll discuss adding these credits back into the budget.
This is where our leadership is taking the position. We're happy to talk about these and discuss what we do about these subsidies. These pandemic subsidies are going to expire at the end of the year, but not while government's shut down.
Experts in the field say that if these credits are extended, insurance companies will react.
If there's a reason to lower those premiums because the enhanced tax credits go back into place, they will work as quickly and as diligently as they can to get those rates back down.
But that doesn't ease the concern of those who rely on Affordable Care Act coverage.
We all take the hit. Taxpayers, carriers, healthcare systems. So we all have to work together in that same debate to make sure that the quality of care isn't impacted by the costs.
We will not have health care if we're paying around $2,000 a month. The average person cannot afford to pay $2,000 a month.
Reporting from Hastings, Ian Mason, Local 4 News.
Open enrollment for 2026 coverage began November 1st, but without a resolution in sight, Families like Sonia's face uncertainty about what they'll be able to afford. Enrollment continues through January 15th.